Okay, so this is for my final OP. So today I'm going to be locating 3 bony landmarks around the body. They consist of the pisiform, the thyroid cartilage, and the pes anserine. So I'm going to do my consent first. So today I will be locating and palpating bony landmarks around your body. In doing so, I will have to use 3 bony landmarks on 2 different bones to work my way there. I will have to use a variety of pressure, so light and heavy. If at any time you feel uncomfortable or the pressure is too much, please let me know and I will adjust to a lighter pressure. Do you have any concerns or any questions?
No.
Do I have your consent?
Yes.
Okay, so for my first palpation, I'm going to be doing the pes anserinus, or the pes anserine, most commonly known as the goose foot. So to get to the pes anserine, first I'm going to start at the lateral epicondyle of the femur. So from the lateral epicondyle of the femur, I'm going to move medial onto the surface of the patella. Then from the surface of the patella, I'm going to move inferior down to this tibial tuberosity. And then from the tibial tuberosity, I'm going to be moving medial and posterior. And you can really feel it's very, very tender, and you can kind of feel your client flinch when you press on it. So the significance of the pes anserine is that it serves as an attachment site for the gracilis, sartorius, and semitendinosus. Okay, so for my second palpation, I'm going to be doing the thyroid cartilage. So for this, the thyroid cartilage, I'm going to start at the manubrium. Then from the manubrium, I'm going to be moving superior to this jugular notch. Then from the jugular notch, I'm going to be moving superior up to the hyoid bone. And then from the hyoid bone, I'm going to be dropping inferior down to this thyroid cartilage, which is very prominently described. So the significance of the thyroid cartilage is that it houses the thyroid gland and also protects the vocal cords. Okay, so for my third palpation, I'm going to be doing the pisiform. So for the pisiform, I'm going to start at the olecranon. Then from the olecranon, I'm going to move distal along the shaft of the ulna until I get to about the distal 1/3. So from the distal 1/3 of the shaft of the ulna, I'm going to be moving distal to the styloid process of the ulna. Then from the styloid process of the ulna, I'm going to be moving distally just a little bit until you feel that big projection, which would be your pisiform. So the significance of the pisiform bone is that it is a sesamoid bone in the tendon of the flexor carpi ulnaris, and it defines the medial boundary of the carpal tunnel with the hamulus of the hamate. Okay, so this is my consent for my soft palpations. So today we are going to be landmarking muscles of the body, stating their origin, insertion, and all of their actions, as well as afterwards putting the muscle into resisted action. So in this case, I'm going to have to use a variety of different pressures, light and heavy. So if at any time the pressure is too heavy, please let me know and I will adjust it to your comfort level. Do you have any questions or any concerns?
No.
Do I have your consent?
Yes.
Okay, so for my first soft palpation, I'm going to be doing the coracobrachialis. So for the coracobrachialis, the origin will be the coracoid process of the scapula. So to find the coracoid process of the scapula, I usually start at the lateral 1/3 of the clavicle, and then from that lateral 1/3 of the clavicle, I just drop directly inferior, and you can feel it. It's like a little fingertip or a projection. So from the coracoid process of the scapula, the insertion of the coracobrachialis is going to be the medial 1/3 of the medial surface of the shaft of the humerus. So if you move lateral along the shaft of the humerus, it's going to be about here. So the actions for the coracobrachialis is that it flexes the shoulder and it adducts the humerus. Okay, so now I'm going to put the muscle into resisted action. So I'm going to place my leg in front of your arm. And now what I'm going to do is I'm going to get you to push against my leg and adduct your shoulder. And as you can see the muscle belly start to contract, and you can also feel it. Okay, so for my second soft palpation, I'm going to be doing the iliotibial tract. So the origin of the iliotibial tract is the iliac, or the tubercle of the iliac crest. So to get there, I'm going to start at the ASIS. Then from the ASIS, I'm going to work my hands lateral along the iliac crest until you feel that tubercle. It's a very bony prominence. And then from the tubercle of the iliac crest, the insertion is going to be the lateral tibial tubercle on the condyle. If I can get you to slightly extend your knee, you can follow it all the way down the lateral side of the leg. It's a very tense band of connective tissue that is sitting on top of the vastus lateralis. So we'll come down here. So for the lateral tibial tubercle on the condyle, so I'm going to start at the head of the tibia, and then if you come just lateral to it, you can feel a very bony prominent landmark, and that is going to be your tibial tubercle. So the actions for the iliotibial tract is that it extends the thigh, laterally rotates the femur, and stabilizes the knee in extension via IT band when standing. Okay, so now I'm going to be doing the resisted action for the iliotibial tract. So while I'm supporting the knee joint, I'm going to ask my client to extend against my resistance. That way we can see the contraction and formation of the iliotibial tract. Okay. And you can feel it really tightens up as you try to extend against the resistance. So as my client tries to extend the thigh against my resistance, you can feel how tight the iliotibial tract becomes, and also you can feel underneath the fibers of the vastus lateralis that are present, and then again the iliotibial tract is superficial to the vastus lateralis, which it is sitting right on top of. Okay, so for my final soft palp, I'm going to be doing the anterior scalene. So the origin of the anterior scalene is the transverse processes of the cervical spines 3 to 6. So how I like to find this is I start at this very projectile C7, and then you can count just C6, C5, C4, and C3. So from C3 to C5 is the originating point for the anterior scalene. And then the insertion for the anterior scalene is the first rib. So how I find this is I go to the clavicle and just come proximal to it. And I'm going to ask my client to take a deep breath in. And as you press in, you can feel an exhale. And as you get your client to do this action, you can palpate the first rib, which lies underneath the clavicle. So for the actions of the anterior scalene, it bilaterally flexes the neck and head. It also elevates the first rib in deep inspiration. It unilaterally, ipsilaterally tilts the head and contralaterally rotates the neck. So it also is located in this posterior triangle of the neck, which is outlined by the upper fibers of the trapezius, the SCM, and the clavicle. Okay, and for my resisted action for my anterior scalene, I'm going to be putting the head and neck into lateral flexion. So I'm going to place my hand here on your head, and then I'm going to get you to try and flex your neck this way. And you can even feel the muscle belly contracting when the lateral flexion is taking place.